Why you? Why this? And why now? Claire.
Why me? Because I have worked on legislation from idea to impact. I know that all of these ideas and concepts we're talking about, the majority of the reason why action hasn't been taken on any of these topics is Mitch McConnell. It is, we have brilliant policy, we have brilliant minds in Congress right now who are working incredibly hard to get things done. But what I have been a voice, a victim of injustice, and I have been silenced, and I have refused to be silenced. I have fought back. I have fought for meaningful reform, and I have continued to serve in the face of it. I didn't let the failing system run me off. I dove back into it. I will never shy away from a tough fight, and I will never let our voices be silenced. And I think, you know, why me? Because I am a fighter and I am going to get things done. Why me? Because we've seen candidates like me succeed in districts just like this. Why me? Because why now, I guess, is ultimately also a question I need to answer. And I'd say, why now is that I literally just couldn't stand on the sidelines any longer. I have worked so hard for equality in so many different forums. I have worked so hard for this country and given so much of my life in service and as a active duty military spouse working in community organizations. Now is the time to put a fighter in Washington who's going to get this done, who is dynamic enough to work across the aisle and make our progressive voices heard as well. And so that's it.
Thank you very much, Claire. Cameron, you'd be next.
The why me, from my perspective, is it comes down to expertise. And sure, I talk about the expertise of growing up in Central Virginia, being married to somebody from Southside, how those are the two big components of the district. But I want to be clear, this is the healthcare election. Unlike any election before it, that is the #1 issue to Democratic voters and to those critical swing voters that we're all talking about appealing to. Healthcare is the issue they care about the most. And the expertise that people care about, that people will look to and people will react to, is expertise like what I have, both as a practicing clinician at the University of Virginia, taking care of patients, but also as the Director of Health Policy and Equity at the UVA School of Medicine, as a member of Virginia's State Medicaid Board appointed by the governor, and then also as somebody who worked on President Obama's White House healthcare team. I have a depth of experience and expertise on the #1 issue that's going to be compelling as we aim to reach those voters who are our swing voters, in addition to the demographic advantages that we already talked about. I think the second question was, why this office? And when I say that this is the healthcare election, I want to be clear, this office as a member of the United States Congress, that's where the action is going to happen to really change our healthcare system and make it work for people. It's the ability to introduce legislation and shepherd it through that process. And having worked in the federal government before, having seen how the sausage gets made, I know that I'm somebody who can do that work effectively. And then finally, why now? Like I said, this is the healthcare election. And then the other piece is, you know, we've got this global healthcare crisis. We've got a crisis of racial injustice. My campaign is built for a time like this.
Thanks very much, Cameron. RD, we're back to you.
I'm the most lucky, blessed man in America. My home is filled with joy. Alice Sue is the most important thing that's ever happened to me. And, you know, I also grew up in a situation that wasn't ideal. I was sometimes afraid of my own safety, my sister as well. My dad passed away from an Oxycontin overdose. But I'm also a Harvard graduate with 2 master's degrees and a veteran of Iraq and Afghanistan. This district is a crazy mix of the Piedmont and college town. And so am I. If you make me our nominee, I will beat Bob Good this fall. And I will vote to make sure that people have health care. And I will vote to make sure that they have infrastructure. And I will fight to make sure that every person is treated the same, no matter what the color of their skin. You know, Mama Sue is 90 years old. And she lives down in North Carolina. Imagine the arc of her life, being born in a place where she wasn't able to finish high school and seeing her grandson go to Harvard on scholarship. This is a great country. And it can be a great country for everyone. And that's why we're doing this. And that's why I need you to support me. Thank you.
Thanks very much, RD. John, you can close us out.
Thank you, Sally. Why me? Because I can win. With all due respect to my fellow candidate, Dr. Webb, this is the leadership election. It's not the healthcare election. This is the leadership election. You have seen the lack of what the lack of leadership has done to this country at the highest level. And when we have a congressman who won't stand up to the president, who has put us in this awful position, you can see what the lack of planning, strategic planning, leadership, the lack of leadership has done to us. I'm a retired Marine colonel. I spent 26 years in the Marine Corps. I learned a lot about leadership. I've been in elected office, not once, but twice. I've had to take tough votes. I've had to vote against the Second Amendment sanctuary resolution. I've hired a county administrator. I've hired a school superintendent. I've hired a county attorney. I've managed a regional district for an international business. I have experience and I have leadership attributes. Why this office? Well, and I know Claire and RD know this term, it's called earning your stripes. I've earned my stripes through local elected office and running for office multiple times and in serving my county at different levels. And now serving as the congressional representative for the 5th district is a high honor and one that I seek, and frankly, one that I'm ready for and prepared for and have experience to execute. Why now? Well, the time to win is now. We have a Republican Party that's absolutely fragmented. There's a window of opportunity here for the right person, for the right leader, to get those 15,000 votes that we need. And we have fine candidates, but I believe I'm the one that can bring it home in November.